My name is Charl Els, and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine at the University of Alberta. This session focuses on the occupational impact of attention deficit hyperactivity disorder, or ADHD. Thank you to the Workers' Compensation Board of Alberta for making funding available for this project. There are no conflicts of interest to declare. The opinions expressed in this presentation reflect those of the speaker and not necessarily those of any collaborator or funding agency. This session provides a brief overview of the features of ADHD, including causation, prevalence, diagnosis and treatment, as well as prognosis. And it focuses on the occupational impact of ADHD, specifically on capacity, risk and tolerance. At the end of the session, participants will be equipped to recognize ADHD as an occupationally relevant medical condition, usually diagnosed first in childhood, but which can persist into adulthood, and its relevance to safety-sensitive settings. Describe the impact of occupational variables, and thirdly, provide broadly outlined evidence-based interventions to achieve maximum medical improvement. At its core, the condition of ADHD represents a pattern of persistent lack of attention and/or hyperactivity or impulsivity. This is displayed more frequently and in a more severe fashion than what is seen in peers. Importantly, in order for the diagnosis to be made, it has to interfere with functioning. The DSM-5 describes ADHD as a neurodevelopmental disorder that presents in childhood and that may persist into adulthood, but it can also be first diagnosed in adulthood, even though it's often more of a difficult diagnosis in adults. Certainly in adults, the coping mechanisms and suppression of symptoms may be more mature than in children, and further, complications like mood disorders, anxiety disorders, substance abuse may all obfuscate and complicate the diagnostic process. What causes ADHD? Well, the underlying causes of ADHD are not known, and like with most psychiatric conditions, the biopsychosocial model applies, with predisposing factors, precipitating and modulating factors, and genetics play a fundamental role in the causation of ADHD. Genetic influences involve dopamine and the D4 receptor gene. There are non-genetic factors that may also be linked to ADHD, and this includes premature birth, exposure to high levels of lead in early childhood, brain injuries, maternal use of alcohol and tobacco during pregnancy. ADHD is the most common neurobehavioral disorder of childhood, and it affects around 4 to 5% of adults, where male and females are equally affected. ADHD is a clinical diagnosis with no single definitive diagnostic test. The diagnosis is made by taking a comprehensive history and performing a physical exam to rule out medical problems that may be causing or contributing to symptoms. For the diagnosis itself, the physical examination is usually non-contributory, and special investigations are conducted on merit of positive findings or to rule out conditions that may mimic symptoms. An evaluation that includes psychological and cognitive testing is recommended and useful and may assist in the diagnosis, as do the use of rating scales. For example, the Adult ADHD Self-Report Scale, Symptom Checklist, or the ASRS. This is helpful in the diagnosis, determining the severity of the condition and also monitoring treatment response. Finally, using the criteria of the APA's DSM-5 allows for a diagnosis to be made with a reasonable degree of certainty. According to the DSM-5, the criteria for a diagnosis of ADHD are persistence, that means at least 6 months, and frequent occurrence of symptoms of inattention and of hyperactivity and impulsivity to a degree that is maladaptive and inconsistent with developmental level. Symptoms are divided into 2 broad categories: inattention or hyperactivity and impulsivity. For inattention, the DSM suggests that the person fails to give close attention to details or makes careless mistakes at work or during other activities. has difficulty sustaining attention in task activities, does not seem to listen when spoken to directly, doesn't follow through on instructions, fails with duties in the workplace, has difficulty organizing tasks and activities, dislikes, avoids, or is reluctant to engage in activities that require sustained mental effort. For example, preparing reports, filling forms, reviewing lengthy documents, losing items required for tasks or activities, is easily distracted by external stimuli, and this may include intrusion of unrelated thoughts, or is forgetful in daily activities, for example, forgetting to return calls, paying bills, keeping appointments. The second broad symptom category in the DSM-5 is that of hyperactivity and impulsivity, and many of these apply to children, less so to adults, may not be seen in adults who are better able to act appropriately in a social context. The DSM also suggests that we would not diagnose the condition if occurring with a psychotic disorder, and symptoms should not be better explained by another mental disorder. In the occupational mental health context, the diagnosis of ADHD is reliant on careful observation, obtaining a detailed history, getting collateral information, and doing validity testing where appropriate, and then completing additional tests to rule out medical conditions that may mimic. When diagnosing this condition, there's of course room for a healthy dose of skepticism in terms of the validity of the diagnosis. In that, questions are raised about the overdiagnosis of this condition, and also given the observed increase in the incidence of this condition on a population health level. Questions have been asked whether we're not perhaps medicalizing normal human behavior. Well, the flip side may also be considered, and that is undiagnosed ADHD may result in significantly increased morbidity, including diminished job performance, increased road accidents, traffic violations, increased occupational risk in safety-sensitive positions. Untreated or poorly treated ADHD may be associated with complications, and this would include anxiety and mood disorders as well as an increased risk of substance use disorders, which would result in the potential for added safety-sensitive occupational risk. Substance use in some may be seen as a way to self-medicate symptoms of ADHD. Regarding the ability to work, risk, capacity, and tolerance as variables, ADHD is associated with a high psychosocial burden, which, as suggested in adults, include the potential for impacting on occupational functioning. ADHD in the working adult can have profound implications for decision-critical and safety-sensitive positions because it can impact occupational capacity due to cognitive symptoms. Some individuals with ADHD may also display disruptive behavior, aggressive outbursts, may have low frustration tolerance, or display frequent mood swings and irritability. And foreseeably so, this may negatively impact on co-workers. The presence of this condition in an adult who is already performing a certain job at a certain level does not typically have additional impact on capacity. Individuals with reduced concentration, focused, or attention spans usually choose to work in jobs that match their cognitive abilities. And with ADHD, there certainly is an increased risk of substance abuse, which always has to be screened for. Individuals taking medications to control their symptoms may also require periodic drug testing to ensure that substance abuse or addiction does not become an issue. If ADHD is left untreated or only partially treated and of sufficient severity, it can increase occupational risk in safety-sensitive settings. In cases of ADHD, the condition may impair, but also complications like substance abuse may equally impair, and certainly medication effects may also impact capacity and risk. Given the high level of responsiveness to treatment, appropriately managed ADHD infrequently results in requirements for restrictions, limitations, or for the need for accommodation. For a person to be fit for a safety-sensitive position, the symptoms of ADHD have to be in remission. Many cases of ADHD remain undiagnosed and on treatment, and there are, of course, many reasons why we want to treat ADHD when it occurs. And two such include to mitigate occupational risks, specifically in safety-sensitive settings, and secondly, treating ADHD results in a decreased risk of later development of substance use issues. Treatment consists of two major components: one, behavioral and other non-medical therapies, and secondly, pharmacotherapy. Best evidence suggests using a combination of such, and non-medical treatments allow for addressing mood and anxiety components associated with the disorders, as well as solution-focused approaches and strategies to deal with and cope with challenges like specific undesirable behaviors and emotions, and to improve social skills. Relaxation training and CBT may also be of benefit. Medication therapy includes stimulant and non-stimulant types of medications, and all drugs, of course, have side effects, and it's important to screen for occupationally relevant adverse effects. Important to remember that stimulant drugs like amphetamines, methylphenidate, may be prone to abuse, and the use of stimulants in persons with a history of substance abuse should be conducted with caution. For drugs that may be abused, aberrant drug-related behavior should be monitored, and for those in whom stimulants pose a significant risk, non-stimulant options like atomoxetine or bupropion should be considered, and these could also be first line. The effects of nutrition and exercise in the treatment may assist with comorbid mood and anxiety issues, but it's unlikely to directly impact the core features of ADHD. So achieving the roughly a 25 to 30% improvement in symptoms is usually considered a positive response. However, in a person with a more severe condition and who wants to enter a safety-sensitive position, a more robust response is required to ensure that no residual cognitive symptoms would impact on the occupational capacity and the risk. Maximum medical improvement is usually expected within about a month. Treatment of ADHD is considered very effective. Most persons have good outcomes for both ADHD and comorbid conditions. Treatment tends to mitigate associated addiction risk, even if treated with stimulants with an abuse potential. The presence of psychiatric or substance abuse comorbidities may adversely impact prognosis if left untreated, and this certainly warrants independent attention and care. With ADHD, usually no disability is anticipated if adequately treated. ADHD is a common condition that usually first presents in childhood, which may persist into adulthood, but it may also first present in adulthood, where the diagnosis is more complicated. Due to the cognitive features, it's a condition that may adversely impact on occupational variables. It may also adversely impact occupational risk. The condition is highly treatable, and with the right treatment, no disability is anticipated. We've included a list of resources which we believe may be helpful. Thank you. We look forward to your feedback and comments, and please help us identify further topics for future discussion. Thank you.